Eczema is an incredibly common skin condition that affects millions of people around the world. It causes itchiness, discomfort, loss of sleep, and it really affects the quality of lives of so many people in a profound way. Most eczema sufferers just give up and decide that they're going to have to deal with it, but in this video I'm going to tell you about the treatment options available for eczema, including some newer ones that I think are truly life-changing. My name is Osama, aka Real Skin Doctor, and I am a dermatologist living and working in New York. On this channel I give evidence-based skincare advice as well as talking about some common dermatology conditions like this video here about eczema. So if you're interested in this content, make sure to hit that subscribe button. So let's kick things off with a really brief explanation of what eczema is. Eczema is basically when your skin's barrier function is no longer working effectively, and so you lose too much moisture and water and you get dry and irritated skin left behind. When it comes to eczema treatment options, the first category that I'm going to discuss are known as lifestyle interventions. The first major lifestyle intervention are things like moisturizers, which I have a few examples of here. This is CeraVe moisturizing lotion, which I'm a big fan of, and this is a similar La Roche-Posay product, which I also like. These are not paid features, I just happen to have them in my bathroom. Now, a moisturizer as an intervention makes sense when you think about that introduction I gave, where I explained that in eczema, your skin's barrier function is not working like it's supposed to. What you're doing is reinforcing that skin barrier using this artificial external layer, kind of like cement filling in the gaps between bricks in a building, and therefore your skin's barrier becomes more effective, you don't lose as much water, and so you no longer have as dry and itchy skin. Another example of a lifestyle intervention that I think is great is actually having a humidifier, and I recommend it to all of my eczema prone patients, especially in the winter months. A humidifier, as the name suggests, increases the water concentration in the ambient air in your room, and because of that there is less of a gradient for you to lose water from the surface of your skin to the outside air. Another useful intervention I think is to take less frequent and less hot showers. That might sound counterintuitive because when we take a shower we're actually putting water onto our skin, but when that surface water dries off it actually leaves our skin more dehydrated after a shower than before. Now I'm not suggesting you guys stop showering, and I take no responsibility for any weird smells that begin to emerge as a result of this video. All I'm saying is try and minimize the length of those showers and try not to shower more than once per day. The final lifestyle tip is going to sound weird, but bear with me. You can actually do something called bleach baths, which involves taking Clorox, like actual bleach, a small amount of it, like half of a cap, and putting that into an entire bath full of water. You then soak the entire body beneath the chin in that bathtub for around 5 to 10 minutes. And the reason why this is effective is because eczema sufferers actually have too much of a specific type of bacteria known as Staph aureus taking over their entire skin. It's normal for all of us to have bacteria on our skin, but usually we have different combinations of bacteria that help to keep each other in check. In eczema sufferers, they tend to have what we call a monoculture of Staph aureus, and that Staph aureus overgrows, takes over every other type of bacteria, and this leads to more inflammation in the skin. With a bleach bath, you basically nuke the entire surface of the skin, get rid of all of the Staph aureus and all of the other type of bacteria, and then you hope that it regrows in more of a balance. Now, you shouldn't be doing bleach baths too frequently, and I would say a maximum of once a week or once every 2 weeks, depending on how your skin handles it. So moving on to the next level of eczema, and that is prescription treatments. You could be doing everything right when it comes to your lifestyle, moisturizing frequently, having your humidifier on 24/7, but maybe your eczema is so severe that you are going to need prescription strength treatments. The main weapon we have against eczema is topical steroid creams, and the reason for that is that steroids are anti-inflammatory. Within the family of steroids, you can have mild steroids like hydrocortisone 1%, which is available over the counter, and then 2.5%, which is prescription, and you can work your way up to a medium strength like triamcinolone, which I'm holding right here, and even all the way up to something like clobetasol, which is a top strength topical steroid cream. As a reflex, some people don't like the idea of using topical steroids because they associate it with having harms to the inside of the body, but the reality is that if you use a topical steroid cream twice a day for up to 2 weeks maximum at any one point in time, you can actually do it safely and effectively, although as always this is not medical advice and you should always speak to your own dermatologist. After that usually 2-week limit of using a topical steroid consecutively, you would then be advised to take a break to make sure that there's no side effects on the skin, and at that point there are also non-steroid topical cream options, and you would hope that after that short-term steroid use your skin has calmed down enough that you can just switch over to using the moisturizers and it will stay under control for a period of time. Because eczema is a chronic condition, you might have to cycle between these periods of using steroids and then taking a break and using it and taking a break, and it can be really frustrating. There are also other types of creams which are non-steroid anti-inflammatory options, and the most popular of these are tacrolimus ointment and Eucrisa ointment. Both of these are seen as safe to use for prolonged periods of time beyond 2 weeks consecutively, and they can also be used on places like the face where we're otherwise a bit more scared to use a topical steroid. So what happens if these topical creams fail, or maybe there's too much of the body involved for the creams to be able to keep it under control? One great treatment option is known as phototherapy. This involves going to usually a dermatology office and standing in something called a light booth. The light booth emits this really specific type of light, most commonly narrowband UVB, and over time this light therapy reduces the amount of a specific type of immune cell in the skin, which is actually the first domino in the cascade that causes itchiness in eczema. It's a great treatment, super safe and covered by most insurances, but the main downside is that you have to go in 2 to 3 times a week, usually for around 8 to 10 weeks in a row. That is a huge hassle to anyone's schedule, but if you're able to complete that treatment, usually you'll go into a state of remission for your eczema for around 3 to 4 months at least. Now let's talk about some newer treatments for eczema. Once again, I'm going to caveat that this is not specific medical advice, and you're going to need to speak about this with your own dermatologist. But there's a new type of treatment out for eczema known as dupilumab. Dupilumab is a type of medication known as a biologic. What that means is that it targets a really specific part of your immune system that is found to be a key driver in eczema, and it helps to turn the volume down on that. It's an injection medication that people give themselves at home every 2 weeks, and it can lead to absolutely life-changing results. It's actually considered to be a really safe treatment as well, and most providers won't even require you to do blood work at the beginning or during your treatment with dupilumab. But keep in mind that it's a treatment you would have to keep up for the long term. There is no one and done cure when it comes to eczema. Your body breaks down dupilumab, and if you stop injecting yourself with it every 2 weeks, you'll find that in around 4 to 6 weeks, most of it would have been broken down by your body, and your skin will go back to being however it would have been without any intervention. And finally, for those few really resistant cases that don't respond to even dupilumab, there are even newer medications that are being experimented with right now, especially a class that are known as the JAK inhibitors. The JAK inhibitors are actually tablet medications, although they do have slightly more of an effect on your immune system, and so they're not considered to be as safe as dupilumab. However, in some really resistant cases, they can still be absolutely life-changing and a great medication for those people. So that is the A to Z on all of the eczema treatments that are out there right now. If you enjoyed this video, please consider dropping a like or a comment down below, and make sure you check out the rest of the channel because there might be some other videos you find interesting too. Thank you so much for watching, and I will see you in the next one.